Оп. У нас не смысл. А звук можно запускать. Ну, должен слышно. Жень, звук можно запускать. Есть, да? Ага. Hello, dear colleagues. How are you? I know you on my channel, Manjulka Berdihodjaev. I'm from Almaty, Astana, Kazakhstan country. It's in Asia, Middle Asia, Central Asia. Yes. Today we are planning to do 11 cases. This is case number 2. Case number 1 was just a diagnostic angiography. We treated patient nearly 7 years ago with the intracranial stenosis and in cavernous ICA and coronary stent was placed. Just a second, I will show you the case number 1. Study date. Okay. This is left side. The protege stent was placed for the subocclusion of the left ICA. Patient has a diabetes, diabetes mellitus, and it was stenosis in cavernous ICA, and it was a subocclusion. And at the period of 3 years after stroke, we placed coronary stent, and stent is working very well, and the left hemisphere is nicely supplied with the blood, and here is okay. It's okay also. It's a follow-up for 7 years, and the right side is also okay. Basilar system is okay. A small stenosis in cavernous ICA, no need for treatment. We gave ticagrelor and aspirin and statins. And there is small stenosis in V1 segment, and we decide not to touch. Just will follow because the left side is okay. Yes. This was the first case. It was some symptoms, hypertension, but finally patient is okay. And now patient number 2, but it's a case number 1. It's a supraclinoid aneurysm with a diverticulum, with the daughter sac and irregular shape. The aneurysm size nearly 11 millimeter. The neck of the aneurysm is 6-7 millimeter. Vertebral system is okay, and on the right side you can see there is another aneurysm on the supraclinoid ICA. It's not the goal of the treatment for today. We will plan for the second session. It's a multiple aneurysms and not a regular shape, and in this segment it might rupture, and second time we will plan to do balloon or stent assist coiling. I think stent assist coiling is better, or we can place flow diverter stent. And on the right side, on the left side, the 3D is like this. The ICA distal is 4 millimeter, aneurysm shape like this. And the plan is to place Silk Vista 4x25. I hope to start here, nearly 379. And the only problem could be disangulation. It's the first problem. Some stenosis might be. And the other part is no problem. Okay, patient premedicated with ticagrelor, 180 milligram tested. It was previously premedicated with the clopidogrel, but clopidogrel was inactive. That's why we changed for Brilinta ticagrelor. And ticagrelor is working, but with ticagrelor, not all the time is useful and comfortable. Patients start coughing, and yes, there is a lot of problems. And here's a small kink. I think it might be a big problem, but not so much. I will take up my guiding catheter. As you can see, there is a curve. Yes, it's an angulation. It's a Philips system. Yes, very useful. And in Astana, we are working from Monday till Friday. I'm using most of the time Canon system, Canon Infinix, and yes, it's different systems. Okay, and patient under local anesthesia. We decide to do it under local anesthesia. Nowadays, most of the procedures we are doing under local. Yes, Devlet is asking about heparin. Usually we need to pass the neck of the aneurysm, and then I can give heparin. Okay, let's see. No problem with passing. Okay, here we can change. Okay, silk clasp sessions. A little bit painful when we navigate microcatheter and wire in MCA territory. Patient can feel it. But I think nowadays more and more mechanical thrombectomy is done with the local anesthesia and conscious sedation. Heparin, this one. I asked 5,000 units of heparin. Besman heparin stisasın. Yes, we are waiting for the saline is coming. Yes. And in Almaty is still snow. And I hope spring will come soon, very soon. Okay. Just a second. I need to push. We have some problem with these Y connectors. I don't know the name of the company where it's come. Your device is all the time stucking. Balkon Y connectorlar var mı? Okay, okay, now I test. Yes, it's some problem. I don't know why. Maybe some companies from neighboring countries start to copy. Okay. Uh-huh. This one. I'm using maximum magnification. Yes, some coughing is still. I'm so sorry. I'm still coughing. Because of this cold winter in Astana. Yes. At my time in Almaty, I stopped having cold and everything was okay. But nowadays in Astana, it's very cold and more chances to have to catch a cold. Okay. I think we can start here because all system can fall down. Yes, it might shrink. Let's look like it's level of bifurcation, but it will a little bit. Okay. Yes, at this angulation all the time it's a little bit risky to play with the forward diverter stand. Sometimes it's better to start here. That's why I must understand because of this angulation. I will push a little bit my micro catheter. Yes, now it's better. Yes, I'm pulling and pushing. Okay. It's not opened. Okay. It's not opened. Okay, let's do some massage with the wire. Sometimes it's helpful. I will keep my micro catheter inside and will push my Chikai Black in parallel. Maybe we will take Eclipse balloon and or Hyperglide and we'll do angioplasty. But sometimes just wire is very helpful. Okay. Let's see. Let's see. It's not well opposed. Mine's a little bit not opposed. Okay. Eclipse пересадка? Мoro. Okay, I will take Eclipse Double Lumen. Ой, не керек, тырхадау керек. Бар ғой? Yes. Okay. Now I want to show the preparation of the balloon. Yes, and не керек жоқ, система пока жалғамай тұра тұр, мынаны алсамыз. Preparation of the balloon. And, it's Eclipse Double Lumen balloon, and nowadays less and less people using balloons because of very nice flow diverter stands and more and more stand assist coiling is more popular than balloon assist coiling, but in acute situation it's better. There is a 7 contrast and 3 saline. 10 cc syringe, it's a 70%, and I'm taking 3 cc syringe, filling it, and now we have a second hub. Just placing the syringe, taking up the balloon, just in this direction, and inflating. And pushing the air from the system and filling the balloon with the 70% of contrast. Yes, now air is out, and after that I'm placing my balloon inside the saline and deflating. Опа. Yes, the first time is taking some time, and it's okay. I'm keeping the balloon inside the water. Так. No, inside the water, and now I will take. It's still deflating. The first time it takes a little bit longer, and when we inflate inside the artery, it's much more quicker. Yes, we're using more and more balloons for the angioplasty, for the assistance, remodeling, for liquid embolic injection, and that's why that's why we need to be ready to use this nice device. The same preparation in my hands in our department. The same strategy in preparation of the Scepter balloon. With the Scepter Mini, we take 1 cc syringe from liquid embolic Onyx or Squid or Menox. 1 cc syringe. It's very useful. It's deflated. And it's very helpful, but the recommendation is 1 cc insulin syringe. We're using regular syringe from the liquid embolics. Yes, now I took my balloon and I'm inserting to the guiding catheter. Okay, a little bit bigger hole of the introducer. Okay, and everything is flushing. We give just intravenously 5,000 units of heparin at the beginning of stent placement. I think stent is fully opened, but to be sure, I will. Yeah, it looks like it's more opened than it was before. I will place my microwire in MCA territory. And will place my balloon here. Okay. And a little bit pulled my balloon because with the flow it will try to go up all the time, because we start to block the flow, and after that the device is trying to go with the flow, pushing with flow. And now we are sure, yes, it's possible to do vaso-CT, but I think balloon angioplasty is most effective and illustrative. The stent is well opposed. Okay, it's just before the aneurysm neck. Everything is okay. Yes, I'm not measuring the milliliters inside the balloon, just orientation with the images. Okay, let's see. Apa қалайсыз? She said нормально. Нормально means normal. Okay. Stop. You may notice our stent is a little bit fell down, but on lateral. Okay. On lateral you can see everything is okay on AP and on lateral. Okay, let's take this. And okay. Yes, distally stent well opposed is here. We started here, but stent now here on lateral. This is the neck, and this is distal part of the stent, and there is enough place for stability. Okay, let's see. From here to here, nearly 6 millimeter, 5-6 millimeter distal, and also proximal is everything is okay. Now I will change the angulation and we'll check in different angulation. Okay. Proximal ICA could be a little bit larger than Silk Vista, but you can see the stagnation, and the supraclinoid ICA is okay, ophthalmic artery is okay. Okay, now we can see like this, stent is okay. And, you can, and nearly 11 minutes from the beginning of stent placement. Okay, let's do it like this. Stent finish here. With no problem. I will a little bit inflate the proximal part, but distal is okay. I'm sorry. I'm sorry. I will inflate a little bit the proximal part. Okay, now it's better. When you do G shape, it's better to go inside the stent. Inflate proximal part, yes, to be sure that stent is well opposed in proximal part. Yes, now I'm sure stent is well opposed. Now is better. And also I will do AP and lateral, and now is in 12 minutes from the beginning of the stent placement. It's a modified Kazakh thrombotest test. We have very final results, and if ticagrelor is effective, that's why we can finish. Yes, nice stagnation. With the Silk Vista, I'm sure everything will be okay. And the next aneurysm on the left side we'll do in next 2-3 months. I will pull my guiding to the common carotid. I will decrease the zoom. Я берусь. Следующий. Yes, today we have 11 patients, that's why we need to be a little bit quicker. Yes, we have one dural fistula, previously treated with my colleagues of the lateral and sigmoid sinus, and the rest of them stenosis, couple of stenosis, and others are mostly aneurysms. Okay, I think we can stop here. Control CT, its algorithm. After placement, any device, we are doing brain CT. Қалайсыз? Жақсы ма? Аха. Аяғыңыздың басын қимылдатып көріңіз. Оң аяқтың басын қимылдатып көріңіз. Табаныңыз қимылдатыңыз. Я. Аха. Окей. Қолыңызды қозғап көріңіз. Аха. Үйіп қалды. Аха, ол манжетадан ғой. Все, қазір бітіреміз. Yes, let's wait. Yeah, 4 minutes. Let's wait for control CT, and then we will start the next case. Здорово, Максим. Точнее, шестерка сложилась. Так, у меня звук включен, так что... Так, Максат Григорьевич на пациент. Ана КТ-ні ортаға үлкен қылып ашып кете салшы, Давид. КТ-ні ортаға ашып кете салшы. КТ-ні ортаға ашып кете сал, үлкен қылып. 3D снимкасын ортаға ашып кете салшы. Все хорошо. As Davlet is doing like on a Siemens Icono. He's staying in the operating room. A lot of radiation, but we tried to explain it's not necessary to stay there. It's an Azurian system. But he liked to do in this manner. Maybe he learned from René, maybe. Okay, but he's staying inside the operating room. Yes, it is okay. Yes, everything is normal. Now we finish our case, and let's wait for the second. You can stay on the channel. The next link will be just after. Okay, thank you.